So, yeah. So, of course, we have the whole pelvic girdle formed by the sacrum and what we call either the pelvic bones, innominate bones, os coxae, but better known if we angle out from the acetabulum, which forms the hip joint, the big blade-like part here, I call it your hands on your hip bone, but it's the ilium with the iliac blade. And at the front, your index finger would be on that ASIS, or anterior superior iliac spine. And coming again from the acetabulum, here anteriorly would be the pubic bone, or pubis, meeting the other side at the pubic symphysis. And then from the acetabulum, going posteriorly and inferiorly to the ischium, ending at that ischial tuberosity, what I like to say is the bony part of your buttocks that you would be sitting on if you're seated. So the whole pelvis, we talk about the pelvic canal and that minor or true pelvis being this part here versus the major or false pelvis, including the more bowl-shaped region over here. In life, of course, there would be a muscular floor back here, but and this is where everything that leaves the body at the tail end passes through that this bony pelvic canal. Continuing down the leg, on the femur, you've got the head of the femur, and then the greater trochanter and lesser trochanter. You know what? Let's switch to the isolated femur. So there you can see the head that forms the hip joint, the greater trochanter and the lesser trochanter. At the distal end of the femur, you're going to have the condyles. They're a medial and lateral condyle. There's two of them with an intercondylar notch. That's probably good enough for the femur. And then if we continue on from the knee on down, you've got what we call the tibial plateau, which in life has these menisci that form, instead of being a flat surface for the bone, for the condyles, forms a bit of a cup for the femoral condyles. Of course, this is the tibia, this is the fibula that doesn't form the knee joint, so it doesn't bear any weight. That's why it's so small. But together, they do both form the ankle joint with this lateral and medial malleolus, the malleoli, the ankle joint being formed with one bigger tarsal bone, the talus. These are all the smaller tarsals. The other big tarsal is the calcaneus that forms the big projecting part that the Achilles or calcaneal tendon attaches to. And then the rest of the foot past the tarsals is going to be the metatarsals, which in life are embedded in the sole of your foot at the base of each digit. And then the phalanges, just like in the upper limb, 2 for the first digit and 3 for all the rest of the digits.